total knee because bone's such a lousy conductor, but you know what? It's listed, so we'll stick with that one.
You have thrombophlebitis.
So thrombophlebitis, which would be like spider veins, and we're not going to do it over his reproductive organs. Acute inflammation.
That says pregnancy.
I'm not going to do it over a pregnant uterus.
Right.
I'm not going to ultrasound a uterus. This is a little bit different waveform than the ultrasound that you're doing for sonograms.
Heat up the baby.
We don't want to heat up babies.
Never.
Breast implants. Now, if I'm doing a leg, I am not going to ask if
Breast implants.
they have breast implants, because it doesn't matter. What I would probably ask the patient if they have any implants, anything implanted in them around the area of treatment. You know, men are starting to get calf implants and stuff. But if I were doing the edge of a pec,
That might
and
be
I had a
important to
woman,
know.
I might ask her specifically if she has breast implants, because I'm not going to get the result. But if you're
Might
doing
wanna
somebody's
use-
low back, I've had students in practical, and they're getting ready to do somebody's low back, and they're asking them if they have breast implants. It's like, you know what, I don't need to know.
Yeah. You might want to use tactful wording when you ask
But-
too.
But you could have like fusion or spinal rods or something, so you,
I
that
don't.
would kind of stuff you'd
Anything
ask
implanted,
for.
superficial
implanted.
metal, pacemakers, I wouldn't want to do it over a pacemaker.
Typically, that would be in their chart if they'd had,
You know,
not
a lot of
necessarily a
times it's
pacemaker,
not
but
gonna
like,
be.
okay.
How
It says epiphyseal plates,
Okay, so
controversial.
epiphyseal plate is what?
And growth
Growth
plate.
plates.
So since that stimulates bone growth, you
They
don't want
worry
to do
that
that.
it could stimulate bone growth
And
and
close the
seal a plate
premature.
early. And adults aren't going to have a
Yeah.
growing plate. A child might. Usually bone is going to be a contraindication, right, for deep heat kind of treatments because it's shallow and you can actually heat up the periosteum and burn their bone. So bone is usually a contraindication. Now, we read that ultrasound is used for bone growth, right, to promote bone growth. There's actually tools that you can put on somebody's leg that to try to stimulate bone growth. That ultrasound is at a much, much, much lower rate than we're doing here. So some of your machines won't even do it at the rate that you would need for bone growth. So, and it takes multiple treatments over multiple days. It takes like a treatment every day for like 20 weeks or
Are
something.
you saying you're not supposed to put it over bone, like bone?
You're not going to do it
Like on
over
the
super.
kneecap
I
or
would never do
something?
a kneecap
Especially
because I'm
this
going to burn
one,
them.
because it's one mega.
Because
Because
I'm
it's so deep.
Yeah.
so
Uh,
deep.
Okay, and like the shunt, like this
I wouldn't do
bone
it over here. There's his anterior tib. I might do his
But you
anterior
can do,
tib.
right,
There's his
right, but you would
tibialis.
avoid there, and you would avoid there.
We do like the
And then,
sides
so
of
hands,
these,
you probably
where there's all the
Right.
muscular attachments and stuff.
What's that now?
I said, we never do over a kneecap at our clinic. It's always like around where
But
all
you
the
go- you go
ligaments
around
and
it
stuff
to the
attach.
side.
How does it affect
Because
the
it
malignant
talks about
tumor?
They don't know, but they worry that it could stimulate reproduction of the
spreading.
tumor. So we don't want it to make things grow faster. We don't want to improve the circulation and the blood flow
Right.
to it because it's more likely to maybe spread too, so metastasize. So they don't really know. What we do, what I usually do with if someone has cancer and the doctor orders it, I always call the doctor and say, look, we don't know what ultrasound does to this. It may increase spread or growth, and then we're going to have a talk with the physician.
Okay.
Sometimes it doesn't matter because the person's so advanced that they're going to die anyway, and comfort may be more important.
Okay.
You're not going to hasten somebody's demise if they're an end-stage cancer anyway. So a lot of the tools that they tell us not to use with malignancies we'll use, but we would only do it after discussing it with the physician and the patient as an option. Your athlete comes in with into ultrasound and they've got a history of a bone tumor in their thigh. I probably wouldn't do it on that person.
Okay.
I've got a young kid at my church that's got bone cancer and may lose his limb. I probably wouldn't do it on something like that, but somebody that was terminal, I might do it.
Provide comfort more than.
So I'm assessing the area, I'm looking at it, I'm checking to make sure it's not inflamed. I would probably position him more comfortably if I was actually doing it. I didn't finish my story about the lotion. I tell people, hey, look, I need a,
There you go. There you go.
for the best ultrasound, I have to have some way to get the ultrasound out of the machine into your body, so I have to use a gel. This gel is water soluble, so I'm going to try not to get it on your clothes, but if I do, it's just going to wash out and not stain. But I'm going to do everything I can to keep from getting the gel on him. I've explained the purpose. We're going for the DP. We're trying to get it to relax. We're trying to improve circulation. Ultrasound can maybe even stimulate healthy tissue growth, so to bring stuff in there that we want it to grow. And it might warm it up so that when we stretch your knee here in a second, it'll be a little bit more stretchy. Place an adequate amount of warm gel on the patient. I have a tendency to gel my head first. You know, I don't want him swimming in this stuff, and I don't want but I don't want it to be too thin, so, but I don't want him just bathing in this stuff. So I'll usually put some on there, and then maybe I'll spread it around in the area that I'm gonna treat. Now I'm spreading it around here while it's off so that I can put on more gel if I needed more gel, or take some off if I just really gooped him up. But I've already spread it around my whole treatment area before I turn on my machine, because once I turn on my machine, I can't break contact. So the mistakes I see patients, PTAs and PT students and novice clinicians make is, one, they start and then they start talking to the person and they stop. So maybe if you can't multitask, maybe you can't talk to someone while you're doing an ultrasound because you can't stop moving the head. Or they'll put it on here and they'll start playing with their machine and they get all enthralled in what's happening here on the top of the machine and they stop moving it and they'll burn somebody. Or they'll start using their ultrasound head to spread the gel. So they'll come over here to the edge and then scoop like this to get it back on, and then come over here and then scoop like this, and now I'm breaking contact off, and that's not good for my head. So I really don't, I want to keep my whole head flat the whole time I'm doing it. And I need to pick a pattern that's going to try to get the center of my head over the whole treatment area at some point. So I want to move it. You know, the book shows side to side. Some people like to do little circles. Some people like to go down and back. I just need to pick a pattern so that that head spends pretty much the same amount of time over all the different areas of it. So I don't want to go make X's because I'm not going to get the correct amount over each thing. So I need to try to make sure that this doesn't break contact and that I've spent the same amount of time over every spot. So, and then in the lecture of the book, it talked about the rate, how fast. Yeah, it's like
4 centimeters per second.
4 centimeters a second. So that's, I mean, that's not super fast or slow, but I'm just going to do a nice gentle rocking. So I'm not going to break my head. I'm not going to start chatting and forget what I'm doing and hold it still. I had a student last semester burn one of their classmates because
So you can
Because they
actually
were-
burn someone like
you
that.
won't see it externally,
Do they feel it?
but
Can
they will feel a burn on their leg. There's one clinician I
away?
know that makes their students overheat each other so that they can
no.
see what
So
it
they know
feels
what it
like.
feels like.
If you want to do it, you can hold it still on your leg for a while and you'll feel it.
So you
start
feel it
to-
right away. It's not like the next day you feel the burn.
You'll start to feel it
No,
ache.
you feel an aching burn.
And you're burning bone, periosteum, so, but you'll feel a dull, achy irritation
So
if
it
you do it
doesn't
too
burn
long.
from like the top to the 5 centimeters, it burns.
Burns inside.
Inside, deeper.
It doesn't feel pleasant. She,
Yeah.
the tech was burning me last fall, and I didn't know any. I thought she was just doing what
And
she
it's
was
from not
doing.
moving it, or is it from intensity, or is it from?
Gel.
You can
She
do
was
both.
moving it. She was putting the
Spread it up
biofreeze
too high.
on, and
Oh,
she.
yeah.
Well, plus she was doing the Achilles tendon right on that bone, so there's no muscle or fat. She was
So
just
it's
right
really
on
good
there.
heat. So it's good for that. Sometimes they make little solid gels that you can put like over an Achilles tendon and you ultrasound through the gel. Or if I were doing an Achilles tendon, I would probably do it in water.
That would have
Ultrasound
helped.
in water?
Yeah,
Yeah.
so you get a plastic bucket, you stick their foot down in the bucket, you stick your ultrasound head in your bucket.
Also, your ultrasound can go underwater?
Sure.
So how does that work? If you put you put their foot in the water and then put the ultrasound in the water, the sound waves just travel through the water like they do the gel? So do you have to move it or you just stick it in there?
I like to aim it at the area.
But you don't
I
actually
can
touch
leave
the
it,
area.
yeah,
And you don't need the gel since you're in the water.
right. And I don't have to touch their skin.
Does the amount of water have anything to do with anything?
It's more to do with the distance away, and you don't want to use a metal bucket.
You don't have to touch it. You're not touching their skin.
Not in the water.
And so does it matter if it's hot, warm, cold, the water?
Comfort.
Just comfort?
So warm. All right, so now that I've done this, so what's my treatment time going to be for an area like this?
5, 10
Could be
minutes.
3 to 5, maybe, 7. People say 7 a lot of times, so I'm going to turn this up
I
to
think that's the
5.
preset on our machine.
I'm at
where
100%.
it's 7.
Now I can start turning up his, now I'm trying to move this thing while I'm turning this up. So what's my treatment? How much can I do?
Oh,
What do you mean, what can you do?
So
Like
am I in watts
intensity?
or in watts per centimeter squared? Yeah, what's my intensity?
Centimeters square.
Which is what? For a deep muscle?
Up to 2.
Okay.
1.5 to 2.
So there's 1 and there's 1.5. So I can go up to here. So now I can start saying, if you feel like it's uncomfortable or if it's getting too hot, it may be, so you let me know. And I either need to speed up or I need to turn it down. Do you
I
feel
can
anything?
feel it, yeah. I can feel it.
You're way up
So
there.
let's turn it down.
So what makes it,
What kind of contact, I think.
is it why was it getting, is it how fast you're moving it?
I would think it has to do with,
It's down between
So
1
the
and the
deeper you want to
1.5.
go, the higher you want that
Right.
intensity. The deeper you want to go. Now, how do you know how deep you want to go?
how deep's the structure?
What are you trying to
You gotta look at
treat
the
and what are
person
you,
and decide
are you
what you're trying to
accomplishing?
treat.
Near the, how far
Thermal or not thermal?
How deep is the tissue? How thick is the tissue?
Yeah. How much skin do you have to go through?
That was
So I'm not
intensity
lifting my sound head.
To see how.
I'm trying to make sure that the center of it goes over the whole area I'm trying to treat.
Intensity is how
Is
the
it burning
deep
at all, or
It's not burning, but I definitely know
You
it's
feel the
there.
heat?
it's
Feel the
heat?
heat,
Intensity
yeah.
is
Do I
how
need to
deep
turn it
it's
down?
going, right?
No, that's not.
It's not very emphatic, no, there's Stephen.
He's like, I don't think
I've never
so.
had it done before, but, I mean, it definitely doesn't look like it's gonna
How?
burn.
Because you want more
Okay,
intensity.
so when I'm done,
deeper.
when it dings, it will turn itself off. I want to turn this thing back off. I want to clean up my, and then I want to make sure that I wipe him down and not get gel all over him. Now I want to go do my treatment. If I was going to try to stretch his knee.
Did you just say when the timer popped off that it automatically